So hi guys, we are soon going to say goodbye to 2023 and let's talk about the recent changes that came this year. One of the major change that came was the 5th edition of WHO in hematology came up and it changed the classification of hematology. So what is the most important thing that changed was the classification of AML, and also there were many new things which were added, like MDS classification changed. Apart from that, we know that JMML was added in the myeloproliferative neoplasms and so on. So today I'm going to just take you like a zip through the AML classification, the changes that occurred. So here we have to see the first chart here. So guys, earlier we used to say AML with recurrent genetic abnormality. Now we say AML with defining genetic abnormality. Earlier we only had very few mutations which were in that category. Now there is a list of mutations which are there in that category. Apart from that, we do not give them number. We name them by the names now. So it is PML RARA. It is RUNX-T1. Okay. So names have been given. Apart from that, there is no comma now. There is 4 colons like that now between the mutations. Okay. Apart from that, 𝗠CEBPA, we include BZIP-𝗠CEBPA as the mutation. And the new WHO also left scope for more genetic abnormalities which are going to come in future. Bye.
Hi friends, in 2023, there are a few things which need to remember. We have seen anesthesia has been growing along with the surgery over these years, but 2023 needs a special mention. Cancer surgeries have been progressing all over this year, like every other year. But in 2023, we realized that from the studies that 80% of the patients who are diagnosed with malignancies have to undergo an anesthesia exposure, let it be in terms of a surgery or in terms of a palliative or a pain control. So that brings the importance of 2023. The theme of 2023 is anesthesia and cancer care. Now, this is not only because of the importance of anesthesia, but also we have recognized that the mode of anesthesia do play an important role in the progress of the disease. So, we have also observed that whenever we use regional anesthesia than general anesthesia, the results have been better, because in regional anesthesia, the opioid use is less, the volatile agent use is less, and even the direct effect of local anesthetic, which is absorbed into systemic circulation, all contribute to the progress or halt the progress or reduce the progress of a malignancy. So, because of all this, the scientific team has decided to consider the theme as in 2023 as anesthesia and cancer care, which was officially declared on October 16th, which you know, it is the World Anesthesia Day or the Either Day. So please remember this is important. I would like to introduce to you a new drug this year, which has revolutionized or paved a new path for the scientific community. The drug is 𝗶𝗶. Now it is just another benzodiazepine. All of you are familiar with benzodiazepine. When you hear about benzodiazepine, you know midazolam and diazepam. But 𝗶𝗶 has got an added advantage that it do incorporate the best features of a short-acting opioid, remifentanil. Okay, so a midazolam with features of remifentanil, it is 𝗶𝗶. Okay, so remember this. What is the advantage? It produces andrograde amnesia. It is very short-acting, faster onset of action. 1 to 3 minutes it act. It's shorter acting than midazolam. Okay, and it doesn't need an organ-dependent metabolism. It gets eliminated very fast. No hangover effects. So it is an ideal drug for procedural sedation, which is definitely going to be a path-breaking in over the next years to come. Okay, US FDA approval has come up only in 2020, and in Europe they have started using in 2021. Now it is our turn, and we will definitely see this in our questions as well as in our clinics. 𝗶𝗶, remember that. Okay. Now the added advantage that the side effect of any benzodiazepine, like a respiratory depression, can be reversed using flumazenil in remimazolam also. So that is also an advantage of it. So remimazolam, procedural sedation, short acting, with all advantages of short acting opioid like fentanyl. Remember this name, okay? This is going to help you. Thank you.
Hey, we are almost at the end of 2023. Before winding up 2023, don't you want to know what are the major contributions which were done in the field of public health or in PSM in the year 2023? Of course, many updates came up, but I would like to highlight 5 which you have to keep in your mind for the exam. First happened in January 4th. On January 4th, 2023, the third dose of fractionated IPV was introduced in National Immunization Schedule, and that is to be given on 9th month along with MR1 and JE1. Second, again in Jan, on 24th of Jan, the first made in India HPV vaccine was introduced. The name is 𝗠ซี้𝗶𝗹, and it is a quadrivalent vaccine against serotypes 6, 11, 16 and 18. Immediately after that, on 26th of Jan, the first intranasal COVID vaccine was introduced by Bharat Biotech. The name is 𝗠tože. Then in August 2023, Indradhanush 5.0 was introduced in 3 phases against 12 vaccine preventable diseases. And the 5th update came recently in December 2023. Union government has decided to rename all the health and wellness centers to a new name, Ayushman Arogya Mandir, with the tagline Arogyam Paramam Dhanam. That means health is the ultimate wealth. So with this, I would like to say bye to 2023, and I'm wishing all of you a very happy and prosperous 2024 and a successful 2024.
Hello my dearest friends. Today I am going to share with you the important recent advances in orthopedics in the past year or about to be past year 2023. The most important advancements have come in the field of robotics. More and more robots have come into the field of orthopedic surgery, and this is especially true for the field of joint replacement surgeries, where the precision by which we can replace a joint has increased many folds with the help of robots. Secondly, in Western countries, they are using artificial intelligence more and more for helping in the diagnosis and management of orthopedic conditions. And third, and most importantly probably, is the use of 3D printing for the construction of various implants and processes in orthopedics. So how this helps is that whenever you are doing a tumor resection, earlier we had to use a modular implant which may not be very suitable for that particular patient, but nowadays we can 3D print exact replica of the natural anatomy of the patient, thereby improving the function by a great deal. Even if all these recent advances have come in, the most important topics for you as far as your exam is concerned are what I am going to say now. 1. Nerve injuries. Every year 1 or 2 questions are going to come from nerve injuries. Nerve injuries are important in anatomy as well as in orthopedics. Second, tumors. Every year 1 or 2 questions are going to come from orthopedic tumors. You need to be able to identify the important orthopedic tumors on an X-ray as well as from a clinical vignette. Then you have metabolic bone diseases, especially rickets and osteoporosis, very often repeated. And then obviously you will have trauma. Don't go into the great depths of trauma and all. There are a set pattern of common questions that are often asked. You need to be thorough regarding that all previous year topics. Alright, thank you, and I wish you all a great 2024. I hope and pray that your exams go really well and you get a very high rank and are able to get into your dream specialty. Alright, thank you.
Hello dear friends, today we will be talking about the latest innovation in ophthalmology that has taken place in the year 2023. So friends, this is about the drug 𝗠ซี้𝗶𝗶. This is actually 𝗠tože injection that is given intravitreally. So this drug is recently being approved by FDA for the treatment of geographical atrophy, that is the end stage dry ARMD. Guys, earlier it was thought that geographical atrophy has no treatment, but now this new wonderful drug has been found to slow down the progression of this disorder. So this targets C3, inhibits its activation, so directly it is targeting the immune system of the body. So now dry ARMD, geographical atrophy, has got a new treatment. The second innovation this year in ophthalmology is about another drop, that is 𝗍𝗶𝗶. It's nothing but 𝗠ป์𝗶𝗶 drops. So friends, this also got recently an FDA approval for dry eye disorder and meibomian gland dysfunctions. So this mimics natural sebum that is produced by the glands, and it creates a new interface between the tear film and the ear. So the mechanism of action is absolutely different. Basically, it reduces the tear film absorption. So the new mechanism, the new drug which has got recent approval this year is by the name of 𝗍𝗶𝗶.
Hello friends, now we are entering the end of 2023. As the year closes, I'd quickly like to highlight a few of the very important developments that I would want you to know. And the first most important in this, I would mention the development of the digital droplet PCR for the identification of trisomies. See, currently for identifying the prenatal trisomies, what we are doing is the non-invasive prenatal testing, right? We use the maternal blood, and after that we separate the fetal DNA, and then we perform the gene sequencing. But this is quite costly because gene sequencing is costly, and with the backdrop of pandemic, the PCR has become very easily available and it is therefore very cheap. So the availability of the PCR as a tool to identify and diagnose or screen the trisomies in the prenatal stage is a very important development. It is going to bring out sea change in how we are managing the pregnancies in the late 30s, the high risk pregnancies where there is a previous history of the trisomies, etc. So that is one very important development which you have to keep in mind. The second is a validation of plasma protein glycation and oxidation biomarkers for diagnosis of the autism. See, till now autism diagnosis has been functional. We do the functional evaluation, and then we give the diagnosis of the autism. So that requires a lot of you can say interaction with the patient, and it is a little bit subjective also before we can give the diagnosis. But with the availability of the biochemical test, this plasma protein glycation products and the oxidation biomarkers, these are all biochemical analytes which can be quickly measured in the laboratory. We can have a definitive confirmatory identification of autism without any subjective variation based on the doctor who is doing the interpretation. So that is again going to bring about a sea change. We will get a more clear-cut picture of the presence or absence of autism, and therefore we can have a more you can say faster and robust response, and the availability of facilities for the patients to manage this autism. Lastly, this is something which overlaps with pharmacology also. In the biochemistry field, there has been development in modification of molecules. In the molecules, the amide groups are somewhat resistant to change. There has been development of a technique which results in the homologation of amides, means you can bring about changes in the amide structures, and the process which has been described by the scientists who presented the paper is they call it the hook and slide method. So if you remember this term, hook and slide method for the homologation of amides, this is a very important development, because now that we have a tool by which we can readily modify the amides, this is going to lead to very fast access to different drug candidates, because we can develop a lot of new molecules, and it is possible that will save a lot of time in the drug discovery process. Evaluating and developing the new molecules is one of the, you can say, the step which takes the longest time, and with this process these things are likely to speed up, and we are likely to get more and more newer molecules for evaluation for their drug potency and efficacy. So these are three very important I would say aspects which have appeared in 2023 and are going to have a huge impact on patient management, and therefore are very likely to land up in your exam. So take care and best of luck for the new year. Happy New Year to all of you.